I think that sexual health is a very important part of the medical interview because it really gives you a window into the patient's life in a different sense. It allows you to build trust with your patient, and indirectly, you can actually assess a lot of the other realms of health that you're trying to evaluate in those visits, such as cardiovascular health, mental health.
Sexual health so much informs our general health. We cannot be healthy, successful people if our sexual health isn't addressed. And if we just ignore it, we're ignoring an entire part of our existence.
My patients, when they're getting screened, participate in a confidential survey that's given on a tablet, and then that information flows in to the electronic health record. I can use some of that information to help guide that conversation that I may be having with the patient that day.
So it's important that using templates that are embedded in the electronic medical record can help give you prompts if you forget, but also ensuring that you're including it because you have to.
So in my routine visits for health maintenance, for example, I make time for a lot of things. Your cancer screening, your medical conditions, your surgical history, making sure you're up to date on your vaccines. It doesn't take but 1 or 2 minutes to add in something like sexual health. In fact, the screening questions could probably take less than a minute. When patients clearly need more time, I tell them, this is really important and I definitely want to talk about this more, but I am going to make another appointment with you so we can just talk about this and address all your issues, not just kind of throw some hormones at them or prescribe something really quickly and see how it goes.
If I only had 2 minutes to briefly go over a patient's sexual health, I think I would prioritize 2 questions. The first one being, are you sexually active? And then the second question I would say is, do you have any questions or concerns about your sexual health or function?
But some things that I may discuss are they in a sexual relationship? Do they feel safe in that relationship? Do they have any sexual health concerns that they wanted to talk about today?
So if I only had 2 minutes to discuss sexual health, firstly, I'd need to know if the patient is having sex. What types of sex? So I know that if I need to do screening, I am screening the appropriate anatomic sites. The other things that I would ensure is whether or not the patient is on birth control if pregnancy is not their intention. The third thing would be asking if they're experiencing any symptoms at the time of the visit.
If a provider told me that during a routine visit they don't have time to talk about sexual health, honestly, I would tell them to just do better. I mean, I'm kind of kidding, but these issues are a part of our patients' lives, whether we address them or not. If you're not going to take their concerns seriously or even ask about them, they're gonna find somebody who will.
I think you have to reorganize and rethink about how you want to approach the office visit, because we know that sexual health is such an important and integral part of someone's livelihood, and it's something that should be discussed as much as possible.
I absolutely sympathize because I know there's a lot of competing priorities that we are asked to perform during this short encounter. One of the key things we can do is start those conversations during those visits. And feel free to say, hey, that seems like a very important conversation that we need to have. Let's set up some dedicated time to be able to really explore this together.
Maybe you didn't receive that training yourself. Recognize that there is training out there. You can feel more comfortable, and practice does make progress in understanding the importance of sexual health as it relates to the whole patient.
It is not the fault of any individual physician if they don't know how to take care of a woman's sexual function and dysfunction, pain, concern. Really, it is a failing of the institutions that trained us. As providers, we got into medicine because we wanted to help people. And part of that is getting the knowledge and education and training that helps us do that.